Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Are you here again this morning?
I'm here again. I'm sneaking in.
Yeah, you're sneaking in. But who'd you bring this morning?
I brought you back Miss Cunningham, the doctor in dentistry.
She looks like she came from
She's such a beautiful.
She looks like she came from a beauty contest,
Yeah.
and she's a doctor. She's a
Making my
dentist.
day.
Yeah.
That's true.
Yeah.
We
so
call
happy
her
with
a periodontist. She's
Yeah.
a periodontist, right? We'll talk
and
about that.
And she can explain her specialty.
Okay, what's this handsome guy next to her?
Oh, the Sergio Arias.
He's a miracle worker.
He's a miracle worker.
I know.
I was teaching Sergio area because we were talking about how Dr. Cunningham and Sergio, they can make miracle happen.
Mm-hmm.
So we were saying how Dr. Cunningham, she does all the plumbing and all the soft tissue, all the bone, put the implants in, and then Sergio come in and look at the face outside, and when the denture go in and clip to those implants. So I say, Sergio, then you become the interior and exterior decorator. And she becomes the plumber and construction person she becomes.
But years ago, that was never the way. We just went to a dentist, and they, you either had your fillings done, or if you were a periodontist, you had gum work. But I was just sharing this with everyone before we started the show, and I think a lot of people don't understand that they can have plastic surgery, they can have all sorts of things, and if they don't take care of their teeth, it's like it's like as soon as they open their mouth and smile, oh, and I was saying I had a friend who has enough money to have work done, and she's been widowed, and she's loving to go out with the guys, but as soon as she opens her mouth, her teeth are not only crooked, but they're brown. And I thought, I wanted to say something to her, but I didn't know how to do that. So for those of you out there, please put the lights on, look in the mirror, and see what you think about your teeth. And if you have any problem, we're going to send you to Dr. Mencia's, the wonderful place where they have actually now 2 offices, and it's the AGI, and that's the Adult Geriatric Institute, and they're going to go and see Dr. Cunningham, and you're going to go see Dr. Arias, right? Is that right?
They all
Everybody?
work in harmony. And, as the listener listen to these 2 experts, go through what they do. I want to remind them that in life, you really get what you pay for. And nowadays, there are many general dentists that go out there and take a course. And I had a patient that I saw a couple of months ago when you went on vacation, Dr. Cunningham. I saw the patient, and the patient, I said, wait until Dr. Cunningham come back, and I'm going to hook you up with a great dentist that I think can work. Because it had cavity in the front. And it was right at the base. And I say, when that tooth of yours break, you're going to have no base to do anything. So I think we have to take care of that tooth so you can salvage and you keep your tooth where it is. Don't lose it. And he said, I think it's going to be too expensive. So he went to a general dentist. And they put like 4 or 5 filling on that one tooth on different area. And I said, well, of course, that is cheaper. You're saving a lot of money. But eventually, you're going to suffer. You're going to be, sorry.
Yeah, and you don't save on the long run because now you've been taking care of it. It's going to fail in 2
when it breaks,
years,
then it's
1
going to be
year.
an implant.
And then it's going to be much worse when you then finally take care of it, and you could have saved if you would have done a few procedures and got it to look really nice. And instead, now you have to go through this.
Now he listened to our program. He's going to law school, and he loved the program. So I was telling him that, listen, as a lawyer, if you do construction and you lose your front tooth, maybe to you it's nothing. But if you're a professional and you deal with people day in and day out, there is no way you're going to work and they're going to hire you with a missing front tooth.
He'll lose the jury.
You lose everything.
He'll
You
go
lose
through
the
the jury and
judge, the
say,
jury.
if he couldn't take care of his teeth, how can I believe him, right? Let's ask, though, how does a beautiful woman like you become a periodontist? What made you do that? Why didn't you just become a regular dentist?
Well, when I graduated in Munich many years ago. I went into oral surgery in Switzerland. So I always liked the surgical part of dentistry, the medical and surgical part. And then when I came to the States, I wanted to, I got my dental license, and I just wanted to do what I wanted, was already planning to do. So that's when I went to periodontics, and I like to do these kind of procedures. As we said before, it's periodontoplastic surgery, it's aesthetics, it's keeping the teeth healthy, all the structures surrounding the teeth healthy, and so that's how I ended up doing this.
And so, Dr. Arias, how do you work with Dr. Cunningham?
Well, the prostodontist, is in charge of restoring and replacing the teeth. And before you can replace or restore any teeth, you want to make sure that the foundation, the bone structure, the gum, the soft tissue, we call it, is healthy. Otherwise, you get in trouble. For example, I had a patient that I saw a couple of days ago, came in, 2 beautiful crowns right in the front. Perfect color, shape, beautiful. But the tissue surrounding those crowns was all inflamed, swollen. The gums will bleed. So there's obviously an issue there, okay? Gums should not bleed, either when you get a new crown, with your natural teeth. If you bleed when you're flossing, if you bleed when you brush, that's a sign. Your body is giving you a sign that there's something going on. So something as simple as having a tooth cap or a crown is crucial to have the surrounding bone and gums around that crown healthy. Otherwise, long term is like we were talking earlier. It's going to fail sooner or later. It's going to cause bigger problems. So my job, the way I work with Cunningham, Dr. Cunningham, is that I plan before restoring the teeth, making sure that all the supporting structure is healthy, and I refer the patients to her. And then she can decide, we decided there's enough bone there to place an implant, or this is what we're going to need to do in order to make it happen for the patient.
I don't think that Dr. Cunningham was at the last Cure Symposium where you performed the miracle of all miracles. Tell everybody about that. That was so fantastic.
So today, before dentistry was... basically, you will look more directly at replacing the tooth and ignore everything else. And it's like you said, sometimes you have beautiful teeth, but it catches your attention that something doesn't fit. So today we try to plan. Before doing anything invasive, meaning before grinding any teeth, before replacing, building a smile. We plan ahead of time by doing a smile analysis and a smile design. And you can do actually a mock-up or a smile trial on a patient before replacing or grinding any teeth. And that will give the patient the opportunity to see the final outcome, what they're going to look before changing anything, meaning before grabbing what we call the handpiece, the drill, and drilling on their teeth. Most of the time you can do that, 95%. If the teeth are in proper position, you can plan that. And in addition, it will give me the information that I need to know if Dr. Cunningham is going to need to do some plastic surgery on the gums. Again, I do a smile trial, and I find that the teeth are nicely shaped and everything, but when the patient smiles, my attention is caught by their gums, and that's what we call a gummy smile. And Dr. Cunningham can expand on that, but then she can come in and sculpt the gums, which becomes the frame for the teeth, right?
And Dr. Mencia, you were really lucky to find these fantastic dentists. It started with, of course, your wife, who is wonderful dentist, and when I first met you, she was the dentist. That's
She
all
was-
we
that
had,
was it,
right?
yeah,
And boy,
exactly.
have you grown this now.
Well, my mistake we can call it a mistake if you want. But
you don't make mistakes. Forget it.
my approach, let's say, was that I thought about having the multi-specialty approach, but I thought of it in medicine. So that was, let's call it my pilot. So we went with the multi-specialty in medicine, and I saw how the outcome to the patient, how satisfied the patient, that on the one roof, we were all working together. And then I noticed with dentistry, sometimes the patient was being seen and they say, Dr. Mencia, this patient was on blood thinner. They are not sure if they took it or not. Could we check the INR and see? And there was one case that the INR is supposed to be between 2 and 4.
What's the INR?
That's the level of Coumadin blood thinner that you are taking. If it's working well, if it's below 2, you don't have enough. If it's between 2 and 4, you are perfect. But if it's above 4, you can bleed. So this person was 11. So it was one of the general dentists that called me in, and I said, do not put the needle on that patient. Don't touch the patient. So we started vitamin K treatment. We brought the INR down. We brought the patient back in 2 days. Now the INR was below the therapeutic range, which is between 2 and 4. He was like 1.9, 1.8. And say, okay, now we can proceed. So I saw how beautiful was the marriage between medicine and dentistry. And then I say, I think it's time for us to start building out the subspecialty in dentistry, since the outcome in medicine had been so great, for the patient, that we can do the same thing in dentistry, and all of us working together. And many times, when they see the patient, Dr. Arias or Cunningham or Dr. Rosemary, Dr. Massey, one of the dentists, we discuss it right there in front of the patient. We are all together, so it becomes a conference right there. And they want to know, do we need to give antibiotic on this patient? Do we need to do anything because it's going to be major surgery? We are in the process of this month inaugurating our first operatory room, our OR, where Dr. Cunningham and Dr. Arias has a room twice the size of a regular dental room. With all
Already
the
looks
equipment.
beautiful.
It
I've
looks
seen it
Is
gorgeous.
this in
yesterday.
Boynton or in commercial?
Right now we're building a commercial in Broward.
Okay.
And so, I'm building up the dental department so that we can accomplish the same thing that we have done in medicine.
That's fantastic. So, Dr. Cunningham, did you know when you first joined them that they were going to be making you into the star?
She said I was born a star.
I don't really know what to say to that.
No, but think about this, because normally you would come here, as you said, you came from another country and you're here, and now you've been able to have maybe a dream you never even thought was possible.
Absolutely. I'm
Working with
very
Dr.
grateful.
Mencia and Dr. Arias, that's really
It's
pretty
I
exciting.
love the office. There's a great atmosphere there. Everybody's
The staff,
on
they
the
are so
same
nice.
page.
Yeah.
The staff, all the other dentists. So
Well, let's
it's
talk
a great
about
place.
people who are afraid to go to dentists. And the reason they're afraid is because they don't want the pain. Now you're talking about gum work. Talk about pain and how you're able to keep people comfortable while you're doing that work.
Well, for anxious patients, we give them sometimes like a sedative before, so they're comfortable. They come in, they're already calmer, and then our work is not much different than any other dental work. We make sure the patients are numb, they don't feel anything during the procedure, they're comfortable. So it's not a lot of difference. I placed an implant 2 days ago, and the patient, he was amazed that this was less invasive to him or less discomfort than he had previous dental work, that he thought it was a really easygoing procedure. So it's less than you actually think, and it shouldn't be painful at all.
One of the mistakes patients make, Dr. Cunningham, is sometimes they go to the dentist and they have to extract one or two, of their teeth, and they say, well, I'm not going to do anything about it. They will offer a bridge or offer an implant. They do nothing. Talk about migration of the teeth. So if I do nothing, what's going to happen to that empty space? It's going to stay there and wait for me to decide?
No. What's happening is that the teeth of rounding the adjacent teeth next to the space where you lost your tooth, the teeth want to move into that space. The tooth on top, the opposing tooth, wants to move. It comes down. So if the patient then later decides that they want an implant, they cannot have it because teeth have moved. Then they would need braces, and then it's much worse. And also, if the teeth they get tilted into these spaces, they lose their support in the posterior. So your whole bite changes. The bite can collapse. So that's why it's important to take care of it as soon as you lose the tooth.
Doctor,
Great. I'm sorry.
no, go ahead.
That's a great point. Also, Dr. Cunningham, the bone. What happens to the bone itself once the tooth is extracted? And let's say you don't do nothing for the future placement of. Let's say, okay, now 10 years from now, they decide that they want to get an implant. You know, what happens if can we expect after extracting the tooth and not doing nothing about it?
Yeah, in the first 6 months, the bone resorbs. Basically, it disappears most about a third to 2/3. So that's the time when you want to really take care of it and replace it, because otherwise you might not be able later.
And and it's interesting because with the resorption of the bone, like you just very well explained, when those patients are ready for denture, even for denture, they don't have enough bridge for the denture to hold on to.
Yes.
And those people are very, very difficult to have regular denture put in. And but let's talk about also how you guys can work together. If a person needs dentures, how can you guys work together so that Dr. Cunningham does her part and Dr. Arias, you do your part so that the denture can fit in and those clip-on, clip-off denture. What do we need?
Clip-on, clip-off denture.
Yeah, instead of putting those gummy sticky thing on,
Oh my
you
heavens!
just clip them on like
Clip-on, clip. It's just like
glue.
the
You
just
mean
like the
glue?
smile that
instead
you
of
do.
gluing
Instead of
them
putting
in,
glue
which is the
on
old-fashioned
denture.
thing.
Today, this kind of the standard of care is having at least a couple of implants to support that denture. So as an implant supported denture, it snaps on those implants. So that's a good question. How do I work with Dr. Cunningham? As we mentioned before, the bone kind of disappears if you don't address the issue early on after pulling the teeth. So for me to have an implant-supported denture or to seat a fixed bridge over implants, I need the foundation, which is the bone and the implants that are placed already. And that's when she does everything from the surgical standpoint, preparing the foundation to build the house, you see. I do all the planning, where the size of the teeth, the number of teeth that we're replacing, the position, okay, and I discuss that with Dr. Cunningham, and then she can come precisely and say, okay, this is where Dr. Arias needs the implants. I can very well put them here, 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 or no, it's not going to be possible. I'm going to have to do bone grafting. I'm going to have to do, soft tissue grafting to build bulk, and then she basically prepares the terrain for me. And then I can build the house.
So bone grafting is if I'm going to put bricks to build the wall, and there is
Right.
a concave, there is a concave area. So the cement will go in there to fill the
Exactly
that
that
empty
void,
space, so that when
space.
the bricks go, they all line up.
They're all lined
perfectly.
up. Because before, look, this is good. That's a great way of
Analogy,
putting it.
yeah.
Because many years when implant came to dentistry, the way it used to be done is we had no communication. The patient came in, I want an implant. I don't want to have those dentures that you take in and out. And I want implants. And they will go to the surgeon. The surgeon will, okay, there's bone here, here, and here. Let me place the implants. They will place the implants where the bone was available without any planning of where the future teeth will be restored. So then they came to me, and then the implants are non-restorable. I cannot build anything over those implants because they're not in the ideal position. And this needs to be planned before doing the surgery.
And that's so important because, I look at patient mouth every day as a geriatrician.
What do you mean when you put that thing in, they go,
When
you're looking at their teeth.
Well, I'm looking
See, we don't
because
know what they're looking.
we both had to screen for oral cancer, so we have to look at the entire mouth, the mucosa. And I see people with implant dentures, and I tell them that was done by a general dentist. And they say, how do you know? And I say, because I can see that, like you well said, Dr. Arias, they will put the implant and then they will leave that open space. So when the denture go in, you can see that they don't belong to the patient because there are spaces there that are empty. The food is going to get stuck in there.
Wow.
Right.
And
So
people need to plan ahead so that the end result is what you want. You want to be happy. You're going to spend money in your mouth. At the end, you want to be satisfied.
Well, one thing I have to say about Dr. Arias, too, you're so humble. He really did what you did before you came here. I mean, he could do all this. So now having him join with someone who's doing it also, and you really have a lot of expertise because, this is a very, very special part of the profession, isn't it? This isn't casual. So when you see someone says that cosmetic dentistry or something, you better find out what their credentials are and exactly. And, they might want to go for a second opinion. Mm-hmm. Some of you are already going to another dentist. Why don't you go? You can stop in and have a second opinion and see if they're doing a good job, right?
And that's true. And, I when a patient tells me, okay, I'm just, searching around, I'm shopping around, I'm not sure, I learn about you online, I saw your name and
heard you on the radio.
Or with Anita. And,
with you, Dr. Mencia.
And Dr. Mencia. So I encourage that, Anita.
Yeah.
And one of the things that I tell the patient is, ask, like normally we are trained, both Dr. Cunningham and I, we document very well what we do. We take photography, we keep, images, and we track our cases from the beginning, before, all the way to the end, and then we do follow-ups to make sure that, the case, the teeth that we made is long-term, is functioning and doing what it's supposed to do. It's making them look beautiful and they're happy. Now, because of that, I have a large, how can you say this? I have many cases that I have documented, large file, with before and afters of my cases. And this is very important. If they go shopping around, that good question. I learned this from Ronald Goldstein, an aesthetic dentist in Atlanta, Georgia. He said that the patient should feel free to ask their doctor, so how many of this have you done?
Right.
Who are you using to make the teeth? Can you show me before and afters? When you go to see a plastic surgeon, he has a binder of before and after cases. And then you can make a bit more informed decision about it.
You know what I haven't done? I didn't give any phone numbers out. I got so interested in what you're talking about. Okay. Why don't you call them down there? I know they're going to be open today, and the dentists are going to be there. 954-489-1345. That's the Fort Lauderdale AGI Medical and Dental Centers. And again, 954-489-1345. If you couldn't get through on the phone, just go down there. Somebody's going to be there to help you. Not a problem. And of course, in Boynton Beach, there's a wonderful, beautiful new medical center that they have, and that's 561-270-6494. So we have lots of places for you to go, but I think everything you've said today. And Dr. Mencia.
And they can call if they feel they need to see Dr. Cunningham. Just call and say, I want to set up an appointment for a consultation. If they feel they need to see Dr. Arias, call and set up an appointment. Or they can just call and say, let me see one of the general dentists so they can tell me what I need. But you can, just come and request the dentist.
Right, because you can have a cleaning. We're into some very highly specialized things, but if you want to just have your teeth cleaned, you can go there and do that.
I had a patient, before we go off the air, I had a patient that went to see Dr. Arias. And he said, well, I don't know, he's so good and he knows what he's doing. But I went someplace else and it was cheaper. And I said, did you see a specialist like him, or you saw a general dentist that can do implant? So no, it's a general dentist. I said, well, you can have it done with a general dentist. You can even have it done here. The end result is what you have to worry about. But if you want to compare Dr. Arias or Dr. Cunningham, you have to compare apple to apple.
Well, a plumber
So
can
that,
come into your house and he can say he can do it too. You know,
Exactly.
you never know. So
Exactly.
I mean,
Right.
you know, I mean, you have to be careful. That
Right.
you have to go to someone who you're going to be proud of what they've done. If you spent the time and the money, let's do it right. And you can't listen to the show and not do it right. We don't allow that, Dr.
No.
Mencia. And you have to go to Dr. Mencia's wonderful AGI. Again, you can call down there. It's 954-489-1345, or get on their website, which is agifl.com. And I have to say, both the dentists, I just call them dentists, prostodontists and periodontists, but dentists, so people understand, are very attractive. So while you're there, mesmerized, if you're a man or a woman, you'll have something very nice. Well, we know why everyone goes to you, Dr. Mencia, because they just want to see you because you're so gorgeous. Okay, I guess they're pushing me off now. You all have to go now that you're going to,
This was so much fun.
yeah,
That was
and
good.
you're going to rush down to the office.
Thank you, Anita.
You're
Thank you
welcome,
so
which is
much.
so important because people are going to be waiting there. Open on Saturdays. Nobody opens on Saturdays
That's
but
right.
you. We're so
That is
proud of
correct.
you. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.